Hello guys, today I'm going to talk about urinary incontinence. Urinary incontinence means that there's a loss of control of my urinary bladder. That is, I'm not able to hold urine, and this can be embarrassing, can cause a lot of stigma when it happens in adults. Children do it every time, we don't complain because they're still developing their children. But when it happens in adults, especially the elderly, it's a source of embarrassment. So what is incontinence? It's involuntary release of urine because there's no control of the bladder, urinary bladder. So it may be a temporary thing, it may be a progressive thing, it may be a permanent thing. What are the types of incontinence we have? Number one is stress incontinence. Stress. I cough, I laugh. You hear someone that I laugh so much I peed myself. I cough, I laugh, I exercise, I sneeze, and causes the bladder to release urine. That is stress incontinence, which is not normal. The second one is urge incontinence. Before I feel like peeing, before I get to the toilet, I've wet myself. Urge incontinence. The third one, overflow incontinence. That is, I've gone to pee. I'm trying to empty my bladder, but it feels like there's still something, so I'm not able to empty it. By the time I talk back my stuff, I'm done with toilet, I notice I'm still spilling because the bladder was over full. So there's overflow incontinence. There's also functional incontinence. That is, there's a problem with the primary function of the bladder, from physical or mental health problems. Someone that has dementia, for instance, we notice, or people that have Alzheimer's, we notice they have incontinence. It may be a problem with the nerve supply in maybe stroke or physical damage in accident. And there's also what we call mixed incontinence. Mixed incontinence means there may be a combination of urge, flow, overflow, functional. There may be a mixture of these other types of incontinence. What are the causes? Number one, weak pelvic floor muscles. Your pelvic floor muscles are the ones that hold up your bladder, they hold up your rectum. In females, they also hold up your uterus and your cervix. And what that does is that if it's weak, advancing age, some medications or kind of exercise you do, it may loosen. And this loosen pelvic floor muscle also loosen the sphincter, that is the tap that hold in your urine in your bladder. If there's nerve damage from accident, from stroke, from people that have diabetes, uncontrolled, mental problem I mentioned, if there's urinary tract infection, it may irritate the bladder and cause a temporary loss of bladder control. There are certain medications that cause you to produce more urine, for instance, diuretics, some antihypertensive medications. It may cause you to produce more urine than normal. So you may have things like overflow incontinence. You may have more urine than normal. You have excessive weight. You are using illicit medications, alcohol, caffeine, tobacco. It may cause you to have incontinence. So your lifestyle, basically. For men, especially when you're above the age of 40, things like prostate problems, prostate cancer, prostate enlargement may cause you to have incontinence. Women, maybe you have diabetes that's not controlled. It may be related to osmotic diuresis. That is, you are producing the sugar on the side of your kidney, sucking more water into your bladder. So osmotic diuresis causing you to produce more urine and then causing you incontinence. What do we notice? You may notice leaking of urine. You may notice the smell. This person always has a particular odor around them of urine or leaking of old urine. When this person tries to lift a weight, coughing or sneezing or laughing, may notice leaking. It's time for you to present to your hospital and say, doctor, this is what I noticed. This person may suddenly feel that they need to urinate. Oh, I didn't drink water today. Sorry, I just feel like going to the toilet. And before they even get to the toilet, they pass the urine on themselves. Frequency. I noticed I went to urinate some 10 minutes ago. Now I'm feeling like urinating again. Then maybe dribbling because of that. This person cannot even get to the toilet before passing the urine. I've peed myself. I have to change my underwear several times. I noticed that I pee more than twice at night. I have to wake up to pee like 2 times or 3 times or 4 times. Frequent urination, that is nocturia. How do we treat it? Present to your hospital. You may need to see your GP first, or if you're in a country like mine, you go and see a urologist. Doctor, this is what I'm seeing. You may need medications, you may need surgery. But before that, we have to look at what is your lifestyle. Do you need to cut down caffeine, alcohol, tobacco, illicit medications? What are the drugs you're using that actually prescribed medications? Do we need to modify it? Do you need to lose your weight? Do you need to exercise more? Then there's what we call pelvic floor exercises, or some people call it Kegels exercises. So you pass urine, you hold it for 3 seconds, pass it for 3 seconds, hold it till you empty your bladder. This helps to strengthen your pelvic floor muscles. Just like we do for children, you may do bladder training. This one, you feel like peeing, you hold in your urine for a while, you don't go and pee immediately. It may also help depending on the type of incontinence you are having. And as a supportive way for our elderly, you can get absorbent pads, just like you have children diapers. You can get absorbent pads to help hold in urine from staining their clothes, from giving that odor, that offensive odor. It helps self-esteem while you're looking for a permanent solution. I will discuss these topics in detail on the live. I'll set an event. I hope I've helped. I'll see you guys on the next one. Bye-bye.